the South African Human Rights Commission, together with the National Department of Health, have appealed to the public to stop hindering people's access to public healthcare facilities, saying access to healthcare services in this country is a right afforded to everyone within the Republic's borders as guaranteed by the Constitution. This comes after anti-immigrant group Operation Dudula has been hogging the headlines, conducting raids in hijacked buildings across the country and preventing illegal immigrants from accessing healthcare facilities in some areas. Here to give a perspective on that story is Operation Dudula President Zandile Dabula, as well as ActionSA Representative Emma More. Good afternoon to the both of you. Zandile, let me start with you. Just give us your sense of your rationale behind some of the activities that we have seen you undertaking, including your members blockading access at some healthcare facilities and asking people to show their papers and documents before allowing them to proceed and receiving healthcare. Why have you been doing that?
Good afternoon, Thulasizwe, and let me also greet our viewers at home. Now, Thulasizwe, you would know that for the past 5 years, we've been trying to engage government with the crisis that we're facing in the country when it comes to illegal migrants, but nobody's taking us serious. I mean, this has a bad impact on us as citizens of this country because we are the taxpayers, and these non-South Africans, most of them are illegal and they don't pay tax. But they are using our facilities. So they are using our facilities, and unfortunately, nobody is saying, I'm very sorry about that. Nobody is saying anything about it. And
all right, Zandile, I think you got muted somehow. Let's allow you to unmute yourself and just find a way to settle your picture while we hear from Emma More of the party ActionSA. Let's start with your own position around, you're quite critical as well about issues of uncontrolled migration in the country, Emma More. But do the actions we are seeing now by groupings such as Operation Dudula align with what you believe to be the solution to the problem that you have also raised?
Thank you very much. Okay, thank you very much, Thulasizwe. Good day, and good day to the viewers, and thank you for this opportunity. So as ActionSA, we do not support or promote any lawlessness in our country. But we say first things first. How did we get here? 31 years into democracy, how did we get here? Where our borders are open and porous, where the government is incompetent. To date, there are no systems to deal or curb this issue of illegal immigration. The borders are porous. So hence, as ActionSA, we said, let us get back to the drawing board and talk to the issue, our Bible, the Constitution. So if you check what we've done recently, we've actually submitted a constitutional amendment that talks to the preamble. The very first one to say it says South Africa belongs to all those who live in it. To be honest, the original intent of this statement was all about the racists in South Africa, not the illegal foreigners, of whom we don't even know the count. So this was the original intent of that phrase, not what we have in right now. So as ActionSA, we are saying, let's get back to the drawing board and actually deal with this. And Thulasizwe, you would know that we've got issues in healthcare. I'm talking about staff shortage. I'm talking about lack of resources. I mean, as Zandile rightfully said, South Africans are the taxpayers. So they are the people funding what? The fiscus that the healthcare is getting the budget from. So if the very people who are contributing to the budget do not get services and other people are sort of prioritized, it's an issue in our country and it needs to be dealt with decisively. So we need to ask ourselves, how did we get here? How is it that citizens themselves are saying they're implementing the law? Where's the government? This is not a new issue, Simelani. It's not. It's been here for decades, to be honest. More than 20 years.
So Zandile, let me bring you back in then and allow you to...
I'm not aware of what is happening.
Yeah.
You know, this leads me to also ask, do we need this national dialogue that they're talking about?
Sure.
Every 2.5 years in South Africa, we've got elections. We do manifestos. Why do we do those manifestos? Why do we go on the ground and ask the people, what is it that you want us to do for you? But today we are going to have the national dialogue. The national dialogue has been done every 2.5 years in South Africa.
All right.
We need to fix our things. We need to be serious. Home Affairs is not working.
Emma More, I'll come back to you just on the aspects to do with the national dialogue and the issue of migration as an element of that mooted national dialogue. But let me allow Zandile to finish the point that she was making about the rationale behind the actions that we have seen, Zandile. You were talking about a lack of law enforcement. Pick up from that point. Lack of law enforcement, what then entitles you to be undertaking the actions that you are undertaking?
Now, because I'm very sorry about that technical glitch we had, but now because we are the concerned citizens of this country and we have the right to citizens' arrest. I know that most of the law enforcers don't understand that, but we as the citizens, we have that right. Now, if you suspect that there is a criminal activity happening there, then you would need to act as a citizen. So what we have been doing is that we have been visiting these clinics because what we know is that they collect medication, they are undocumented, collect medication from different healthcare facilities, and they go and sell them in their countries of birth. Now, we have seen that in the past month, I think there was a bus going to Zimbabwe that had medication. Now, we all know that that's business. They're taking advantage because our system does not talk to each other. When you go to a hospital, there's no way where they capture that so-and-so has just received medication. They go to the second hospital because they know that the system is not talking to each other. So because we are the taxpayers, and I mean, South Africans are angry. You could tell how Mama Emma is expressing herself because nobody taking action. I mean, we are on autopilot. We don't have a president because the president decides to prioritize foreigners over us. I mean, it's been 5 years. We've been trying to engage them. Yeah. We've marched to the Union building, but nothing has happened. So we're taking it upon ourselves to save this country because we have a constitution and we are guided. So, I know that they always tell us that the constitution says everybody have the right to health, but they will not tell you that when you are a migrant, you need to come to this country. Section 17 says that when you come to this country, you need to have proper documents. You need to have your work permit if you're here to work, and you would have your medical certificate. Now, you would have insurance that will cover you medically when you're here in this country. But because most of them are illegal, they will not have that. So because most of them don't even have permits, they will not have that.
Zandile, a key argument you've been presenting in the last few days has been that you are entitled to effect a citizen's arrest when you suspect that a person has committed a crime. And you're absolutely right, that is there in terms of the Criminal Procedure Act. But many would say what you are doing is not a citizen's arrest. It is interfering with a right of a person to health care as guaranteed in Section 27 of the Constitution. Granted, you may not like that those people are entitled to the right, but factually as it stands, that's the provision in the Constitution, unqualified right to it. And I don't know, unless I've missed it, I've not seen you effecting arrests. I've seen your members turning people back. Slightly different.
Section 27 says everyone has the right to medical attention. Now, when you are a migrant, you can get, if there's an emergency. I mean, we always say this, that life comes first. If there is an emergency, you will be allowed to go in. But if it's your normal monthly checkups, you know, if you're on chronic medication or something like that, then you need to go to a private hospital where you're going to pay, because when you are a migrant, you must pay for yourself.
Where do you get that, Zandile? And I hate to quibble with you about provisions of the law, but because you go there, let me go there as well. Because Section 27, subsection 1 says, everyone has the right to have access to healthcare services, including reproductive healthcare. What you're talking about is Section 27, subsection 3, which then says no one may be denied emergency healthcare. But the initial right, it says everyone.
But when you go to Immigration Act 17, it says that when you are a migrant, you should have your medical certificate. You should have a medical insurance, basically. So it talks to each other. So you can't be illegal and be a criminal and then expect that the government, because there's that section 27 that talks about a free medical attention. Now that was for South Africans and not basically for immigrants. That's why there is an Immigration Act that will talk about the medical insurance. So it talks to each other. But now the likes of Human Rights Commission, they don't want to dwell into the section 17 of the Immigration Act because they know that by law, that's what's supposed to happen. Yes, everybody has the right to medical attention and emergency especially. We don't want anyone dying here in this country. I mean, we are fighting that people need to go back to their own respective country and go and fix. We don't want people dying here. So we will allow you to get your emergency medical attention. But if you are undocumented, we will unfortunately have to hand you over to the law enforcers. And those law enforcers, they don't want to do their work. I mean, I'm sure you would have seen what happened in Rosettenville when we had police officers and we wanted to show them where crime is happening. And they were not keen. They told us straight that they do not have problems with illegal migrants. Stand
by for a moment. I want to take a call. One of our viewers who's watching and wants to weigh in. Mr. Kok, good afternoon. Please go ahead.
Good afternoon, sir. You know, sir, quite frankly, I do agree with all these people with regard to what is really happening in our country. It seems like our country is the only one that is free for all. And I believe that our constitution is being misinterpreted. You know, this has been ongoing, and it's so frustrating for so many of us in this country that is taxpayers. We are paying tax extremely high only for people. You know, for most of these immigrants are taking advantage of our country.
All right. Thank you for that, Mr. Kok. Emma More, your response to that, the sense that, you know, no one is hearing the cries of South Africans who want this issue of migration to be handled and handled properly.
Okay, thank you very much. You would know that 70% of patient files, we've just learned about this that recently, in Johannesburg, 70% of patient files belong to foreign national. That is abnormal. You would know that we've been fighting as ActionSA. There's 1.1 billion that is owed to Steve Biko and Charlotte Mateke for treatment that the foreign national have received. The department is unable to trace. The department is struggling to actually recoup this money. And this money is required so that we can continue to give the services that we are giving to everybody. So hence, as ActionSA, we are saying, let's go back to the drawing board. Let's talk to the preamble. Let's talk to Section 27, because we know that we are overburdened and under-budgeted. We don't have capacity. We don't have staff. We don't have financial resources. So basically, all we're saying is that let's fix the Department of Home Affairs. Let's close the borders. Let's have the right people in the country. If you are documented, UCC is saying it very well that they are criminals. So as ActionSA, we also reject the continued abuse of our hospitals by people who are illegal in the country, because truly speaking, they are criminals. Similarly, when we do budgets, we've got SAHRC that gives the statistics of South Africans to our department again. So when we do budget, we talk to the numbers that we have. We don't know the other numbers that came illegally. So for instance, when you are given a certain amount and it said that it will cater to the numbers that SAHRC have given, but when we check in hospitals and clinics, we've got more people who are coming. Recently, I heard from one of my leaders in the legislature. We serve in the same health department. She was telling me that there was South Africans who were following foreign nationals, whether legal or illegal. They were going from clinic A to clinic B to clinic C on the same day to collect the same medication. That's fraud. That's criminal act. That is not right, and we're not going to promote this. So as ActionSA, we're not saying let's continue barring them so that they don't get the services. We are saying let's go to the root cause of all of this, the Constitution, because it's a noble book, and you know, when it was established, it was only us and the legal immigrants in the country at that time.
Yeah.
But now we've got a government that is uncaring.
Right.
We've got a government that is indecisive when it comes to protecting South Africans. We've got a government that is incompetent.
All right.
Because this issue is not new.
Let me
It's
take a
been-
call. Let me take a call from Zandile in the Eastern Cape, who's watching and wants to weigh in on this conversation. Zandile, good afternoon. Please go ahead.
Good afternoon, sir, to you and the viewers. Good afternoon, ladies. I agree with Mrs. Zandile in that we cannot apply the Constitution to illegal immigrants who have failed to enter the country illegally. You must first apply the Home Affairs laws. If they meet those laws, then yes, we can then apply the constitutional acts to them because they are criminals. They have entered illegally. It's basically treason what they are doing.
Okay, I hear you, Zandile. Let me put a proposal to you before you go, Zandile. In terms of how this works, the Constitution is the supreme law of the land. So the Home Affairs Act, the Immigration Act, and all the other acts are subservient to the Constitution. What do you say to that? That actually, if the Constitution, what the Constitution says is what carries the day, and if there's a contradiction between what the Constitution says and any other act, it is the Constitution that prevails.
I agree with you that the Constitution is the highest law of the land. But remember, the Constitution is like a child. It is supposed to grow and be amended with the way society is moving. And South Africa's Constitution has never been amended. And that is why we are where we are. If the Constitution were to be amended to align with the way the country is moving, there would be little to no contradictions. And that is why there's always constitutional reviews, legal reviews, and all of that. The Constitution, yes, it does prevail. But if the law says, no, Constitution, you are outdated, Constitution must be reviewed to accommodate the recent laws and the way things are happening in society.
Thank you for your time this afternoon. I've got to leave it there, ladies, but thank you for this conversation. That's Zandile Dabula, who is president of Operation Dudula, as well as Emma More, representing ActionSA.